Welcome to Keuchel's Corner. I'm Dr. Keuchel, and this week we'll be talking about dry needling. So dry needling is something that does really well with muscle-specific complaints, muscle injuries, or any kind of strain within the system. So when you have an injury to the body, it's naturally going to protect itself by tightening down and creating trigger points that create pain so that you don't want to move that body part and you give it time to heal. The only problem with that is muscles do heal and do best through movement. And so we want to decrease that pain as much as possible as early as we can within the rehab process so we can start to utilize and move our bodies in ways that are beneficial to stimulate the proper movement patterns that we want. This article talks about how dry needling does a really good job of enhancing the care as an additional treatment to anything you're doing within the office that can be manual techniques such as myofascial release or exercise geared towards moving that body part or that movement pattern a little bit better. And dry needling works by actually taking a needle and running it through the skin into the muscle or irritated tissue that we want to stimulate. When we run that needle into that area, you're essentially poking holes into the fascia, improving blood flow to improve movement and reduce tension within that area. It's something that does a great job at reducing pain because it stimulates certain processes within your body to release endorphins that are your body's natural way of reducing pain. So it's a way that we can avoid taking kind of painkillers that are going to basically block all healing from happening within the system. We want a small amount of inflammation to happen, and so this needling allows us to create that at a very small and targeted area that we need to release to improve our overall movement within the system. So if you think about it, dry needling is basically a way of utilizing a reset button within the body. We can use it to open up a window for movement, decrease pain, stimulate the healing process overall. And by utilizing early on within care, we can reduce the amount of time that we're sidelined and increase the amount of time that we're actually working towards getting back to what we want to do. So that's my take on dry needling. That's how I typically utilize it. It's something that has really helped me personally, as well as a lot of patients in the office, get to the finish line a lot sooner than they would have anticipated. So if you have any more questions about dry needling, how can we use, any questions about when or where this is most effective, let me know. Reach out to me at the email that I have tagged below or contact the office. Other than that, I look forward to doing more of these videos with you guys. Let me know what you want to do next or go forward. Thank you.